Aloha, my name is Alicia Duvall. I am the Early Intervention Coordinator for the National Kidney Foundation of Hawaii. Welcome to our Early Intervention Programming webinar. This webinar will cover all of the early intervention programs that the National Kidney Foundation of Hawaii has to offer, along with some basic information about chronic kidney disease. Welcome. All right, let's start off with some facts. Did you know that 1 in 3 American adults is considered at risk of developing kidney disease? That number is even higher in Hawaii, with 1 in 2 people considered at risk. And currently, 1 in 9 American adults actually has kidney disease, and some don't even know it. It is the 9th leading cause of death in the entire United States. And as a disease that is irreversible, the only way to prevent it is through early detection. So what does it mean to be considered at risk? Well, with 1 in 2 people in Hawaii considered at risk of developing chronic kidney disease, it's very important to understand the risk factors. Diabetes is the leading cause of chronic kidney disease because the extra levels of blood sugar make the kidneys filter too much blood, and although this extra work is hard on the filters and can cause a decrease in function over time. Similarly, with high blood pressure, the elevated rate of the blood pressure can cause damage to the arteries and the blood vessels and filters within the kidneys. These risk factors can also be passed down genetically, and it's very important to be aware of any family history of kidney disease, diabetes, or high blood pressure. The ethnicities that are considered most at risk are minorities of African American, Hispanic, Japanese, Chinese, Filipino, Pacific Islanders, Native Hawaiians, or Native Americans. Similarly, people who are over the age of 60 are more susceptible. So what is chronic kidney disease? Chronic kidney disease is the slow loss of kidney function over time, leading to kidney failure. When both kidneys fail, the body can no longer clean the waste products out of the blood and send clean blood back up through the system. It is known as the silent killer because you don't really know you have it until it's too late. There are no symptoms. Kidney failure is considered when your GFR, or your glomerular filtration rate, is at 15% or below. So when your kidneys are functioning at only a 15% rate or lower. Understanding how important it is to educate people about this disease, the programs department is dedicated to educating the people of Hawaii through a spectrum of comprehensive community-based programming, including awareness, prevention, education, and support. We have 5 service areas of programming to support this, and this webinar is focusing on early intervention programming. The Early Intervention Programming Service Area provides services in both early education and early detection, including our Kidney 101 presentations, your Kidneys in You presentations, general screenings, kidney urinalysis screenings, kidney early detection screenings, and the National Keep Healthy kidney screenings. I will go into more detail of each of these programs throughout the webinar. Our early education programs consist of our Kidney 101 and your Kidneys in You presentations. These hour-long presentations are given to the community and teach about kidney health, kidney disease, risk factors, early detection, and any health-related topics. And they are performed for the general public and health professionals. Our early detection programming starts off with our smallest screening, our general screening. At this event, participants fill out a risk assessment to identify if they have any risk factors, have their blood pressure checked, and are given take-home protein urine kits that they can do in their own home. The tablet is a color-changing tablet and changes if there is a sign of protein in the urine. Participants are asked to follow up with their physicians for any further testing. Our next early detection program is our kidney urine screening analysis. This mid-level screening provides a free community risk assessment to participants, on-site blood pressure testing, and on-site urine testing. Multi-sticks are used to test many things, including glucose and protein. At the end of this event, participants are able to have a one-on-one medical consultation with a clinician from the community to go over their results. Our largest early detection program is our KEDS program, our Kidney Early Detection Screening. This comprehensive screening includes a free community risk assessment, body mass index measurements, blood pressure testing, blood glucose testing, and urine testing. At the end of this event, participants are able to have a one-on-one exit consultation with a medical professional to go over their results. Our last early detection program is the National Kidney Foundation's Keep Healthy program. Similar to our KEDS program, participants fill out a free community risk assessment, have their blood pressure checked, their BMI calculated, and an on-site urine test. At the end, they are also able to have an exit interview with a medical professional to go over their results. All of our early intervention programming is provided to communities at no cost and is open to anyone ages 18 or older. Thank you so much for listening to our webinar. Please feel free to contact me, Alicia Duvall, the Early Intervention Coordinator at the National Kidney Foundation of Hawaii, with any questions. Mahalo.